Recent research has revealed a fascinating link between eye inflammation and the overall health of the brain. Changes within the eyes, often dismissed as minor irritations, can sometimes serve as early indicators of deeper neurological concerns. The eyes are not only windows to the soul, but also mirrors reflecting the state of our nervous system. Inflammation in ocular tissues may signal underlying processes that affect the brain, highlighting the importance of paying attention to these subtle signs. Understanding this connection can help us recognize potential neurological issues sooner, paving the way for timely intervention and improved outcomes. This section explores how the eyes can reveal crucial information about brain health, setting the foundation for a deeper discussion ahead. The human eye is a complex organ, intricately connected to the central nervous system. Its structure includes the cornea, lens, retina, and optic nerve, each playing a crucial role in vision. The retina contains specialized cells that convert light into electrical signals, which are then transmitted to the brain via the optic nerve. This direct pathway means that changes in the eye can often reflect underlying neurological conditions. For example, certain patterns observed in the retina may indicate issues such as multiple sclerosis or diabetes. Because of this close relationship, the eyes are sometimes referred to as windows to the brain, offering valuable insights into both ocular and neurological health. Inflammation in the eyes, also known as ocular inflammation, refers to the body's response to injury, infection, or irritation within the eye tissues. Common symptoms include redness, swelling, pain, blurred vision, and sensitivity to light. These signs can be caused by a variety of factors, such as infections, allergies, autoimmune conditions, or exposure to irritants. Ignoring these symptoms can lead to complications, including permanent vision loss or the spread of infection. Early recognition and prompt treatment are essential to protect eye health and prevent more serious outcomes. Eye inflammation is increasingly recognized as a potential early warning sign for several neurological disorders. Conditions such as multiple sclerosis, Alzheimer's disease, and other brain-related illnesses may first manifest through subtle changes in the eyes. Inflammation in the optic nerve or surrounding tissues can signal underlying issues within the central nervous system. Researchers have found that these ocular symptoms often precede more pronounced neurological changes, providing valuable clues for early diagnosis. By monitoring eye health, medical professionals can sometimes detect neurological disorders before more severe symptoms develop. This connection highlights the importance of comprehensive eye examinations, especially for individuals at risk of neurological conditions. Recent scientific studies have begun to uncover a significant connection between ocular inflammation and brain pathology. Researchers have observed that inflammatory processes in the eye can mirror or even contribute to neuroinflammatory changes within the brain. Clinical evidence suggests that patients with chronic eye inflammation, such as uveitis, may have an increased risk of developing neurological conditions, including multiple sclerosis and Alzheimer's disease. Advanced imaging techniques and biomarker analyses have further strengthened this association, revealing shared inflammatory pathways and cellular responses. These findings highlight the importance of considering ocular health as a potential indicator of broader neurological well-being. As research continues, understanding this link could lead to earlier detection and improved management of both eye and brain disorders. Inflammation can move between the eyes and the brain through several interconnected mechanisms. The immune system plays a central role, as immune cells and signaling molecules can cross barriers and trigger inflammatory responses in both regions. Shared blood vessels, such as those in the optic nerve and surrounding tissues, provide pathways for inflammatory mediators to travel. When the body detects an infection or injury in one area, immune cells may migrate through these vessels, spreading inflammation. Additionally, the blood-brain barrier and the blood-ocular barrier, while protective, can sometimes become compromised, allowing inflammatory agents to pass through. This interconnectedness means that inflammation in the eyes can signal or exacerbate inflammation in the brain and vice versa. Understanding these pathways is crucial for diagnosing and treating conditions that affect both organs. Certain changes in the eyes can signal underlying neurological concerns. Persistent redness, ongoing pain, or sudden alterations in vision should not be ignored. These symptoms may indicate issues beyond simple eye strain or infection, potentially pointing to problems affecting the nerves or brain. For example, unexplained double vision, loss of peripheral sight, or difficulty moving the eyes can be warning signs. If these symptoms persist or worsen, it is important to seek medical attention promptly. Early evaluation by a healthcare professional can help identify and address neurological conditions before they progress. Doctors use a variety of diagnostic techniques to evaluate eye inflammation, which can sometimes provide clues about underlying brain health. Common methods include a thorough eye examination with a slit lamp to inspect the front and back of the eye for signs of swelling or redness. Imaging tests, such as optical coherence tomography, help visualize deeper structures and detect subtle changes. Blood tests may also be ordered to identify infections or autoimmune conditions that could affect both the eyes and the brain. In certain cases, doctors might recommend a neurological assessment or brain imaging to rule out related disorders. By combining these approaches, physicians can better understand the connection between ocular symptoms and possible neurological issues. When it comes to treating eye inflammation, several approaches may be considered depending on the underlying cause. Common treatments include anti-inflammatory medications, such as corticosteroid eye drops, and antibiotics if an infection is present. Early intervention is crucial, as addressing ocular symptoms promptly can help prevent the spread of inflammation to other parts of the body, including the brain. In some cases, untreated eye inflammation may lead to more serious neurological complications. Therefore, regular monitoring and collaboration between eye specialists and neurologists can be essential for comprehensive care. By managing symptoms at their source, the risk of severe outcomes can often be reduced. Regular monitoring of your eye health is essential, as changes in vision can sometimes indicate underlying issues within the brain. Pay attention to symptoms such as sudden vision loss, double vision, persistent headaches, or unexplained eye pain. If you experience any of these signs, it is important to seek medical attention promptly. Early detection and intervention can make a significant difference in treatment outcomes. Routine eye exams not only help maintain visual health, but can also serve as a window into broader neurological well-being. By staying vigilant and consulting healthcare professionals when concerning symptoms arise, you can better protect both your eyesight and overall health.